more than half of the 5,500 children on the hospital dental surgery waitlist have been on it for over 4 months. Health New Zealand says nearly 3,000 kids are stuck in line, many of them with painful infections, complex dental issues, or conditions that can't be treated in a regular clinic. Not only that, but of the 825,000 kids that are enrolled in public dental care, more than a third are overdue for a checkup. To help the catch up, the government's rolling out 20 mobile dental clinics and also referring older school kids to private dentists. Some areas are also outsourcing procedures to the private sector to speed things up. However, the Dental Association warns that fixing the backlog could take up to a year and says more needs to be done early on, like tackling sugar-heavy diets and making sure community dental services are resourced to prevent problems in the first place. The association's Director of Dental Policy is Robin Whyman, and he joins me now. Robin, hello.
Morning, Leah.
What, Robin, was the first thing that ran through your mind when you saw nearly 3,000 kids waiting for over 4 months for dental surgery or to be looked at?
It is a significant problem, and there are a lot of children that need to be provided with care under a general anaesthetic, and at that number, the concern we have is that looking also at Health New Zealand's numbers from the end of last year, they're getting through about 800 or 900 operations a month. That's simply not enough to keep on top of that number and actually make the progress back to 4-month waiting lists. So unless the number has risen, and it may have done because they are outsourcing more out to the private sector and to mobile surgical services, we're not going to bring that number down.
Robin, are we talking, in the intro I said, these kids, nearly 3,000 of them, have quite complex dental issues or conditions that they can't be treated in a regular clinic. How do they get to that stage? When we say complex, what are we talking? Are we talking removal of teeth or?
Yeah, often we are. So there's a range of things that are going on. For some of the young children with poor dental health, there have been issues of diets high in sugar, perhaps not a great deal of exposure to fluoridated toothpaste, brushing their teeth. We certainly know the numbers are higher in areas where we don't have fluoridated water. So those preventive things that we know will prevent dental decay aren't necessarily happening. But for some of the children, there are other complicating factors, and so it's important we don't just focus on those things. We do have groups of children with disabilities. We have children with very high levels of anxiety. Some have developmental problems with their teeth as well, and so those situations are going to occur. We know that, for example, around about 15 to 20% of children will have molar teeth, permanent molar teeth that don't form properly, and a number of those need to be removed. So it is a complex range of issues, but yes, a very large group of the children have high levels of dental decay.
So when you mentioned, Robin, anxiety, how are you talking about that they won't go to a dentist? The parents can't get them to a dentist.
Well, they'll get them there, but it's then the fact that if there's a lot of dental treatment needing to be done and a child's needing to sit through a lot of appointments with local anaesthetic and things like that, it's beyond particularly very young children's ability to cooperate and manage that level of care. A lot of these children are in that sort of 5-6 year old area, and a number cooperate and do really well, but some have a higher level of disease, and that's going to be manageable for.
How did we get here, Robin? I mean, workforce shortages, yes, COVID-19 impacts have been all named as contributing to the growing wait list and delays, but hasn't this been brewing for longer than that?
Yes, in part. So if we look at the numbers for particularly the community oral health service, which is a very important part of the system to focus on, because this is exactly like it is for other health conditions, that if we have good primary care or community care, we can reduce the burden that we then have for the hospital-based services. So that's the same discussion you'll hear being talked about from the medical groups and the nursing groups as well. The community oral health services problem has been that the main workforce for them has been dental therapists and now oral health therapists. Is changing the training program. we've always known that there was going to be a significant number of our dental therapists retiring and leaving practice. Just that's the profile of the age cohort. We've changed the training program to oral health therapy, which gives that group of professionals a wider scope of practice, a wider range of things that they can do. And then there's the challenge of whether people choose to work in the public service, whether or not they choose to work in private dental practices and provide perhaps adolescent care or dental hygiene care. And we're also told by some of the academic staff at the university that quite a number of them last year chose somewhere other than New Zealand, chose to go offshore.
So are we looking like, we know we've got issues the same with GPs, they're retiring, and we haven't got enough doctors to fill the spots. Is this what we are? It's the same. It's the same with the dental industry.
Well, it's certainly the same for dental oral health therapy. That's right, and we are also concerned about our dentist workforce as well. So the dentist workforce situation is slightly different. The numbers in training for dentistry are capped with a government funding cap at 60 per year. That has been the same number basically since the 1980s. In fact, it was lower for the mid-1980s through to about 2016. It dropped to 54. Then it was put back up. But that number at 60 hasn't moved in New Zealand for 40 odd years. And so we're simply not training our own workforce of dentists in New Zealand as well. So we have a shortage of dentists in the workforce, and we can see that when we look around the country, at both when we go and talk to our members and when we look at the maps that tell us what the dentist numbers are around the country. Most of the provincial areas of the country are low in dentist numbers.
The government's rolling out 20 mobile dental clinics. I mean, that's a positive, obviously, Robin. But I mean, it sounds like it's really a drop in the ocean of what's actually needed.
Well, the 20 mobile dental units are important. It's important that we stay on top of replacing older dental units. That will be part of what those group are doing, and also expand the ability of services to deliver in more places. So more providers, Māori Pacific providers in particular, are focused for those mobile units. That's a good thing, provided we've got the workforce to look after them and actually run them. And so, yes, the mobile dental units are a good investment, provided we've got the workforce to run them.
Yeah. I've just had a listener text in, Robin, Mike, who said, who would have thought removing all the dental nurses and clinics from primary schools would have caused any issues in the future? When did we remove? I remember we used to call it the House of Pain, but when did they leave schools?
Well, there was never a dental clinic in all schools. That was kind of in New Zealand thought that there is, but that was never actually the case. But there were a lot more dental clinics than there are now. So around about 2004-05, it got to a point where what were the old school dental clinics were reaching the end of their life, really. They were not fit for purpose. They were too small. They didn't have the modern standards of equipment. They didn't have things like infection control that we needed at the right level. So the government at that time reinvested in Community Oral Health Service, put quite a lot of money in actually, and we built bigger hub clinics and mobile dental clinics as the next stage going forward with more modern equipment. So that was really a big change, and for a lot of people there's still talk about the fact it would be better if it was in schools. The thing you've got to recognise is a lot of those clinics, even before they were decided not to be run, were standing empty for quite a lot of the time because oral health had improved for quite a lot of the population, and so they weren't needed all the time. And so we had a lot of facilities standing partly empty. And so it was a sensible move to get a better use of our capital, if you like, and a better use of the equipment. But we've also got to make sure people can get to the services as well, or the services can get to the people.
As it stands at the moment, Robin, it is free for under 18s. Is that correct?